Our first topic would be about the Republic Act 7875, also known as the National Health Insurance Act of 1995. So what is it? It's an act instituting a national health insurance program for all Filipinos and establishing the Philippine Health Insurance Corporation. So it's now called PhilHealth. It's the Republic Act created PHIC, which shall provide health insurance coverage and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. It serves as the means for the healthy to pay for the care of the sick and for those who can afford medical care to subsidize those who cannot. The priority of the program would be the underprivileged, the sick, the elderly, the disabled, women, and children. The general objectives of the program would be to provide all citizens of the Philippines with a mechanism to gain financial access to health services, create the National Health Insurance Program, hereinafter referred to as the program, to serve as the means to help the people pay for health care services, prioritize health prioritize and accelerate the provision of health services to all Filipinos, especially that segment of the population who cannot afford such services. Um, Establish the Philippine Health Insurance Corporation, hereinafter referred to as the corporation, that will administer the program at central and local levels. So the members under this act would be the employed sector program members, or those compulsory coverage of all employees in government and private sector. So all those who are employed in the government and private sectors are encouraged to be member of this of PhilHealth. Individually paying program members, voluntary coverage of the self-employed and others. Sponsored program members, which refers to the indigents pre-identified by the LGUs, covers the poorest of the poor. The lifetime members or the retirees, pensioners of the GSIS, including uniformed and non-uniformed personnel of the AFP, those that have completed their 120 monthly contributions, and it includes the overseas Filipino workers members. So the coverage for the PhilHealth are inpatient hospital care, would include room and board, services of healthcare professionals, diagnostic laboratory and other medical examination services, use of surgical or medical equipment and facilities, prescription drugs and biological subjects to the limitations stated in Section 37 of this Act, and inpatient education package. For the outpatient care, the coverage would include services of healthcare professionals, diagnostic laboratory and other medical examination services, personal preventive services, and prescription drugs and biologicals, subject to the limitations described in Section 37 of this Act, and emergency and transfer services. So who can avail the benefits of the program? A member whose premium contributions for at least 3 months have been paid within 6 months prior to the first day of his or her dependent's availment. So what do you mean by dependent? It would be the legitimate spouse who is not a member, the unmarried and unemployed legitimated, illegitimate, acknowledged children as appearing in the birth certificate, legally adopted or stepchildren below 21 years of age, children who are 21 years old or above but suffering from congenital disability, either physical or mental, or any disability acquired that renders them totally dependent on the member for support, and the parents who are 60 years old and above. Though in the recent amendment of this act, those who are senior citizens are already automatically members of PhilHealth. This act provides a framework for the creation of Philippine Health Insurance Corporation. It includes the powers and functions, exemption of taxes and duties, board of directors. This act also identifies the National Health Insurance Fund for where the money would be, the finances, where the money would be taken from the accreditation of healthcare providers and the penalties in case there are those who healthcare providers who won't um, follow these acts. So it was approved on February 14, 1995, and amended with the passing of Republic Act 9241 to RA 10606, or also known as the National Health Insurance Act of 2013, to RA 11223, or the Universal Health Care Act. So we'll not just I'm not gonna dig deep on the act because we're gonna take forever. Okay. So next topic would be the DOH Administrative Order number 2010-007, or also known as the National Framework for Quality in Health. So the vision for this framework is quality health for all. The mission ensures safe, effective, efficient, responsive, equitable, and accessible health services and products in the Philippines, especially for the poor and vulnerable. The goal for this order would be to provide guidance for a comprehensive and strategic approach for quality-related activities consistent with the national health goals and reforms to ensure better health outcomes, client satisfaction, and financial risk protection. So the strategies, as enumerated by these or AO, are enhanced client and community satisfaction, institutionalize continuous quality improvement in healthcare at all levels of the health system, harmonize all initiatives and interventions that have direct and indirect impact on quality to achieve the desired health outcome, guide future policy development related to quality of care. So this is the National Framework for Quality in Health. So as you can see, for the country level, all quality-related interventions and investments shall contribute to the attainment of the national objectives, which are client satisfaction, better health status, and poverty reduction. And to achieve these goals, this would rely on the contributions from the health sector, as well as the improvements of non-healthcare determinants of health, for instance, economic status, education, housing, water, and saturation and sanitation. So this is for the system level outcomes. Existing and future quality related interventions and investments shall define and set performance targets with regards to their contribution to one or more system level quality dimensions, including responsiveness, effectiveness, safety, efficiency, equity, and access. So for effectiveness, it means delivering healthcare and products that improve health outcomes for individuals and communities based on need as supported by evidence-based knowledge. For efficiency, that means delivering healthcare and products in a manner which maximizes resource use and avoid waste. Resources are used appropriately to ensure optimum benefits for patients and population. Responsiveness and patient-centeredness would mean healthcare that establishes a partnership among practitioners and their families to ensure that preferences and aspirations of individual service users and the cultures of their communities are taken into account. Healthcare which is responsive to and respectful of the patient's values and choices to promote patient satisfaction at every healthcare encounter. Safety, delivering healthcare and products which minimize risk and harm to service and medical product users, healthcare and products that ensure that the patient and staff do not suffer undue harm from the treatment itself and from the manner it was given. Access, ability of the people to obtain healthcare and products that are timely, geographically and financially reasonable, social-culturally sensitive, and provided in a setting where skills and resources are appropriate to medical need. And for equity, the extent to which a health system does not vary in quality and deals fairly with the distribution of healthcare and its benefits to the people, regardless of socioeconomic status, religion, gender, race, ethnicity, political inclination, or geographical location. Um, for the reform level outputs, the deliverables of any quality intervention shall be directly linked to reform objectives and performance indicator frameworks, such as the ME3 indicator framework of Formula 1. I'm just gonna skip the approach process because I'm gonna dig about that deeper later on. Organizations and people, all quality related interventions and investments shall ensure broad stakeholder involvement and clearly define stakeholder roles, responsibilities, and contribution. So, what are the approaches to quality as indicated in the framework? Empowerment of consumer, institutional regulation and accreditation, licensing of health facilities and accreditation, improvement of quality of clinical practice, evidence-based guideline development and assessment of local clinical practice, professional development, licensure for health professionals, capability building, individual healthcare provider competence, professional self-regulation, institutional management and development, institutional institutionalization of quality improvement initiative, leadership commitment and management responsibility and quality plan, human resource management, data and information management, incentives and rewards for quality care, healthcare financing, ensuring quality among medical products and health technologies, advocacy and social marketing for quality, and interagency collaboration and networking. So this AO also created the Intercluster Oversight Committee for Quality Health, created through a department personal order. It is chaired by the undersecretary designated by the Secretary of Health. So the functions for this committee would include develop appropriate policies, standards, guidelines to implement the national framework for quality health, harmonize all initiatives on improving quality health in the health sector to ensure the alignment of these initiatives to the national framework, develop monitoring and evaluation system for the implementation of the national framework for quality health, oversee the implementation of the national framework for quality health, recommends researches to be conducted to provide evidence for continuous improvement of quality health in the country, and provide updates and technical advice to the DOH Executive Committee on matters pertaining to quality healthcare. So, as mandated in this AO, the roles are these are the roles and responsibilities of the Department of Health. So, develops quality policies, guidelines, and standards that shall support implementation of quality in the healthcare setting, provides technical assistance to stakeholders related to standards and promotion of quality health, promotes quality in the healthcare system to counteract limited logistical and human resource and improve working conditions, develop a system that shall integrate the various quality health initiatives within the sector. DOH offices with regulatory functions shall define their inputs to provide standards for licensing, accreditation, certification of health facilities and products, establishes an effective mechanism for giving incentives and rewards for quality at the national level, shall take the lead role promoting quality health through policy formulation, standards development, and regulation, shall mobilize resources for quality initiatives, transparency on quality and cost performance of healthcare providers, proper stewardship of health resources at all levels, and institutionalize a mechanism in facilitating accurate data on benchmark levels of key indicators per level of and geographical areas of health facilities, physicians, or healthcare organizations. So, for the local government units and leagues, they shall uphold quality standards in healthcare through promotion of quality in healthcare delivery within its area of jurisdiction, pursues targeted quality improvement strategies through provision of appropriate resources that support health facilities under their administrative and technical supervision, promotes quality standard activities in the pursuit of a functional, coordinated, and responsive system of quality health service delivery adapted to local conditions and as appropriate to the local area and population. employs effective mechanisms to ensure implementation of the national policy to all sectors of healthcare within its jurisdiction, and provides rewards and recognition for good performance. For um, the Philippine Health Insurance Corporation shall implement a continuing quality improvement program that shall ensure that the health services rendered to the members by accredited healthcare providers are quality necessary to achieve the desired health outcomes and member satisfaction. Strategies include accreditation process, utilization review, monitoring and review through outcome assessment, formulation and review of program policies, translation of standards in the medical evaluation of claims, and research studies on effectiveness of programs. Implement benefits that shall promote quality assurance program to accredited healthcare providers and facilitate the transition for accreditation by an independent or third accredited body. For the regulatory agencies like the DOH, FDA, and PRC, they shall ensure a fair, valid, and credible process, encourage quality improvement despite resource limitation, establishes a database of information to determine compliance, pinpoint problem areas, and highlight opportunities for improvement. For the academe, they shall contribute to the conduct of evidence-based operational research related to quality and approaches, inclusion of courses on quality management and improvement into the health curricula. And for the private sector, this sector plays a critical role in ensuring quality whether as provider of health services or recipient of care, purchases or payer, local advocacy and support among others, and the private sector should maintain a collaborative approach to provide quality assured services and improvement continuous improvement. Um, so for the other government agencies, they shall ensure proper coordination with DOH and uphold the use of the National Framework for Quality as basis in the development of their policies affecting the health system. The Philippine Regulation Commission or PRC shall ensure that only competent healthcare professionals are allowed to provide services to the population. The Department of Science and Technology or DOST and the Philippine Council for Health Research Development or PCHRD shall provide the direction in accordance to the Unified Health Research Agenda. And the Department of Interior and Local Government shall integrate quality framework in their policy and program directions at the local level. For the oversight body, mechanisms of management of quality, accreditation surveyors, information system, and quality assessment, their role would include ensure a credible accreditation process, management of available resources such as accreditation fund, and solicit support from other providers, local and international bodies for quality improvement. So that would be about National Framework for Quality in Health. So theories to quality management. These are Walter Schuhart is known as the father of statistical process control. He was an employee at Western Electric and Bell Telephone Laboratories. He developed control chart theory with control limits, assignable and chance causes of variation, and rational subgroups. In 1931, he authored Economic Control of Quality of Manufactured Product, which is regarded as a complete and thorough work of the basic principles of quality control. So the statistical process control, it is the use of statistical techniques to control a process or production method. SPC tools and procedures can help monitor process behavior, discover issues in internal systems, and find solutions for production issues. So here in the right side, this one is the original model for the statistical process control. Sorry. This is the Schuhart cycle. I mean, specification, production, and inspection. What Walter Schuhart also made this Schuhart cycle also known as the plan, do, study, check cycle, is derived from the notion that constant evaluation of management practices, as well as the willingness of management to adopt and disregard unsupported ideas, are keys to the evolution of a successful enterprise. Another theory with regards to quality management would be from W. Edwards Deming. He was a protege of Schuhart. In 1950, he taught statistical process control and the importance of quality to the leading CEOs of Japanese industry. He is credited with providing the foundation for the Japanese quality miracle and resurgence as an economic power. Um, so he developed further the PDSC cycle. So according to him, organizations that focus on improving quality would automatically reduce cost, while those that focus on reducing cost would automatically reduce quality and actually increase cost as a result. So this is the, on your right, this is the PDCA cycle as improved by W. Edwards Deming. So plan, meaning find and note down opportunities. Do, implement the solution. Check, study your findings and observations from your testing phase, and act, implement or improve the process. W. Edwards Deming also made the theory of profound knowledge. So W. Edwards Deming had created the 14 points of total quality management. This would include create constancy of purpose for improving products and services, adopt the new philosophy, cease dependence on inspection to achieve quality, and the practice of awarding business on price alone, instead minimize total cost by working with a single supplier, improve constantly and forever every process for planning, production, and service, institute training on the job, adopt and institute leadership, drive out fear, break down barriers between staff areas, eliminate slogans, exhortations, and targets for the workforce, um, eliminate numerical quotas for the workforce and numerical goals for management, remove barriers that rob people of pride of workmanship, and eliminate the annual rating or merit system. Institute a vigorous program of education and self-improvement for everyone, and put everybody in the company to work accomplishing the transformation. Another theory would be from Joseph M. Horan. Joseph M. Horan worked at the Western Electric from 1924 to 1941. He was exposed to the concepts of Schuhart. Horan traveled to Japan in 1954 to teach quality management. He emphasized the necessity for management at all levels to be committed to the quality effort with hands-on involvement. He recommended project involvements based on return on investment to achieve breakthrough results. So this is the theory of Joseph M. Horan. The quality trilogy, also known as, would include the quality planning, quality improvement, and quality control. If quality improvement project is to be successful, then all quality improvement actions must be carefully planned out and controlled. So these are the steps. An awareness of the opportunities and needs for improvement must be created. Then improvement of goals must be determined. Then organization is required for reaching the goals. Training needs to be provided, initiate projects, then monitor progress, and then recognize performance, and then report on results, then track achievements of improvements, and then repeat one if ever there's problem with the process or the quality. Another theory would be from Philip B. Crosby. He was known for the theory of zero defects. So according to him, there are four absolutes of quality management. This would include quality is conformance to requirements, prevention of non-conformance is the objective, not appraisal, the performance standard is zero defects, not that's close enough, and the measurement of quality is the cost of non-conformance. So the steps for continuous quality improvement, according to Philip Crosby, would be attain total commitment from management, then form a quality improvement team. Create metrics for each quality improvement activity, then determine cost of quality and show how improvement will contribute to gains. And then train supervisors appropriately, then encourage employees to fix defects and keep issues logs. Create a zero defect committee, ensure that employees and supervisors understand the steps to quality, then demonstrate the company's commitment of holding a zero defects day. And then goals are set on 30 to 60 or 90 days schedule. Then determine root causes of errors, remove them from processes, create incentive programs for employees, create a quality council and hold regular meetings, and then repeat from step 1 to ensure a quality improvement. Another theory would be from Ishikawa. Ishikawa studied under Deming, Horan, and Feigenbaum. He borrowed the total quality control concept and then adapted it for the Japanese. In addition, he authored SPC text in Japanese and in English. Ishikawa is best known for the development of the cause and effect diagram. This one on the right, which is sometimes called as Ishikawa diagram. He developed the quality circle concept in Japan, whereby work groups, including their supervisors, were trained in SPC concepts, and the groups then met to identify and solve quality problems in their work environment. So the cause and effect diagram, also known as the Ishikawa or fishbone diagram because it looks like a fish, is a visualization tool for categorizing the potential causes of a problem. The quality circle, another tool defined by Kaoru Ishikawa. In this, a group of workers who do the same or similar work who meet regularly to identify, analyze, and solve work-related problems. And according to Kaoru Ishikawa, these are the seven basic tools for quality improvement. The Pareto analysis. A Pareto analysis helps to identify the big problems in a process. The cause and effect diagrams, or this one, the Ishikawa diagram, will help to get to the root cause of problems. Stratification analyzes how the information that has been collected fits together. Check sheets look how at check sheets would look at how often a problem occurs. Histograms will help monitor variations. Scatter charts would demonstrate relationship between a variety of factors, and the process control charts would help determine what variations to focus upon. So these on your right are the examples of the basic tools. So this one, the cause and effect diagram, the check sheet, Pareto chart, histogram, control chart, scatter diagram, and the flow chart. Another theory would be the European Foundation for Quality Management model, which is based on 9 criteria for quality management, 5 of which covers the basis of what a company does and 4 covers what a company achieves. So these 5 on what a company does would be leadership, policy and strategy, people, partnership and resources, and processes. And for the 4 would include the results or the customer results, people results, society results, and key performance results.